This is a video discussion of the digestive system. Looking at our first couple of objectives, we have this picture here showing what we call the greater omentum. And the greater omentum is we call it the fatty apron, and what it is, it's a sheet of connective tissue that covers the abdominal cavity. So here you can see it has kind of an abnormally kind of irregular border here, but this is the stomach right here, this lighter brown structure here, and it attaches to the greater curvature of the stomach and then extends over and covers the abdominal cavity. So it has fat embedded into it, it has some lymph glands embedded into it, and it just provides protection as a covering over these delicate digestive organs. In this picture here we can see the greater omentum has been lifted up and away to expose the large intestine here and the small intestine here. So this is just a loose covering over the digestive cavity, and it's called, or abdominal cavity, sorry, and it's called the greater omentum. The mesentery is the connective tissue that extends from the wall of the abdominal cavity and attaches to the digestive organs. So here, this yellow connective tissue here that holds the intestines in place, we call this the mesentery. And it has blood vessels running through it, we can see. It too has lymph nodes running through it. So this is the mesentery, and the loose sheet of connective tissue that covers the abdominal cavity is the greater omentum. So starting with structures in the mouth, when we think of digestion, digestion begins in the mouth. So we start with the mouth, looking at the digestive processes, and looking at the oral cavity. This is the muscular tongue with ligaments that attach to the hyoid bone at the top of the larynx. But this is the oral cavity, and we have the hard and soft palate, which we looked at before with the respiratory system. And then we have the uvula, the soft flap of tissue that's basically just an extension of the soft palate. And that helps to protect food from going up into the nasopharynx when we swallow food from the oral cavity. So again, we have the tongue with the oral cavity above and the two divisions between the oral cavity and the nasal cavity, and that's the hard and soft palate with the uvula. So when we look at the mouth, looking at the teeth, we have, first of all, in the front of the mouth, we have these 4 front teeth on the top, and we have 4 teeth on the bottom. These are the incisors. We have the 2 central incisors, and then on either side of that, a lateral incisor. But collectively, we call them the incisors. So they're the front middle teeth. There's 4 on the top, 4 on the bottom, the incisors. Then we have a pair of canines on the top. We have 1 here and 1 here. And then on the bottom it's here and here. So these are what are enlarged in carnivorous animals like a dog or a cat or a wolf. These are the canines, and those are for tearing or ripping of flesh. And if you feel your canine, you can feel it has kind of a pointy end to it, and then near the base where it attaches to your gum, you can feel that it has a little ridge on the inside, and that's characteristic of the canines. Then we have a pair of premolars. So if we count, we've got the first 4 teeth, then we have the canine, then we have a pair of premolars on either side. These are also called the bicuspids, and if you feel those with your tongue, you'll feel they have 2 cusps or 2 points on them on the surface. Those are the bicuspids. So we have a pair here, and we have a pair here, the bicuspids. And then beyond that, we have they're called the molars, sorry. Another name for these are the premolars, but we have a pair of molars beyond that. We have 3 pairs. So we have on the top 3 molars here, 3 molars here, and on the bottom 3 molars here, 3 molars here. The last pair is called the wisdom teeth, and those don't come in until the teenage years, sometimes even in the early 20s. So those are the teeth that you have to know for the test. Again, we have 4 incisors, 1 canine on either side of those incisors, then we have a pair of premolars, and then we have 3 molars on either side, with the last pair being the wisdom teeth. So we're going to look close up at the oral cavity here, and what we find is we have 3 pairs of salivary glands. And here we can see the largest gland is the parotid salivary gland, located in front of the ear, and that secretes saliva into the oral cavity through the salivary duct. So this is the parotid salivary gland. And if you've ever eaten or drank something very sour, you can almost feel this gland ache as it's secreting its saliva into the oral cavity. So that's the parotid salivary gland. Then we have the submandibular gland here and the sublingual gland. These you don't have to know for our exam, but just interesting to know that they are there, and we have a lot of saliva production into the mouth, which helps break down starches and helps lubricate food, helps fight infection. And when a person has the mumps, that's usually an infection of the salivary gland, so it causes them to have a really swollen face. Luckily, we get vaccinated against the mumps, so we don't see that infection anymore. So looking up close at the tooth, the different parts of the tooth, if we look at just basic regions, this region of the tooth that is above the gum line, we call this the crown. And then we have the gum, or the gingiva. And then the part of the tooth that is below the gum line, this region here, from here down, this region is called the root of the tooth. So it's below the gum line. And the hard surface coating on the crown of the tooth is called enamel. This is the hardest substance produced by the body. It helps prevent cavities, and it's about the thickness of a dime in most people. Some people have less enamel production, some have no enamel production, and that puts them at high risk for tooth decay. But this is enamel. It covers the surface of the crown. What forms the bulk of the tooth, this blue material, is called dentin, and this has a little bit of shock absorbing ability, so when the teeth are smacked together, say if someone bumps your lower jaw and your teeth hit together with a lot of force, it doesn't shatter the teeth because this has somewhat of some give to it, which allows the tooth to stay intact. This is called, again, dentin. And then inside the tooth is the living part of the tooth. It's the open space on the inside is called the pulp cavity, but what fills that space is pulp. And in there we can see blood vessels, nerves, some connective tissue, and this is, again, is the living part of the tooth. When a person has a root canal, typically there's some infection that has invaded this pulp cavity, and the dentist essentially removes all the pulp from the pulp cavity and fills it with an inert, non-living material to keep that tooth in place. But the tooth is no longer living at that point, so therefore it needs a cap to cover the surface, as it would fade and change color over time, but at least they can keep that tooth. So moving on to the other parts of the digestive tract, going back up here to the side view here of the oral cavity, we have the oral pharynx, which is just below the uvula to the tip of the epiglottis. This is where food passes when we swallow. And then we have the laryngopharynx, where that food will continue to move past, where we see the start of the larynx, but that epiglottis will direct that food toward the esophagus below. So we have the oral pharynx from the tip of the uvula to the tip of the epiglottis. And then we have the laryngopharynx from the tip of the epiglottis to the start of the esophagus. So this is where food will actually pass. And then, like I said, it enters into the esophagus. Here again we can see the uvula and the back of the oral pharynx, and we can see the tonsils, the palatine tonsils on either side on the lateral walls of the oral pharynx. So moving on then to the esophagus, this is the first part of the digestive tract once it leaves the mouth. And again, the mouth is the where digestion begins. So when you talk about the digestive tract, the mouth is the beginning. And then again we have the esophagus, and this food will move through muscular contractions to the stomach. So here's the stomach below, and there's wrinkles on the inside of the stomach that are called rugae. So these wrinkles allow the stomach to stretch and accommodate more and more food. Those are the wrinkles or rugae of the stomach. And then we call this inner margin, this shorter margin here of the stomach, we call this the lesser curvature. And on the outside we call it the greater curvature. And recall that the greater omentum attaches here to the greater curvature of the stomach. So we have the greater curvature and the lesser curvature of the stomach. And then that leads us to the small intestine. So here's the stomach. This first part here of the small intestine is called the duodenum. So it receives the contents from the stomach through this little sphincter here. You don't have to know the name of that yet, but the duodenum is this first part of the small intestine that attaches to the stomach. So here we can see the stomach, the duodenum, then it zigzags into a long network of tubular structure, and this is the jejunum. So the jejunum is a major portion, kind of a central portion of the small intestine where absorption takes place. So that's this region here, the jejunum. And then as that small intestine ends and starts to get near the large intestine, for the large intestine to receive its contents, this is called the ileum. So the last portion of the small intestine is called the ileum. And there's a valve that again controls the secretion of contents, or the movement of contents from the ileum to the large intestine. So this is the ileum. So we have the duodenum at the beginning of the small intestine, the jejunum, and then the ileum at the end of the small intestine. And then that leads us to the large intestine. And the large intestine has a small finger-like projection coming off of it right at the beginning of the large intestine, and this is called the appendix. And oftentimes this can get filled with stool and it can't clear out because of the small, narrow shape of the appendix, and some people have to get their appendix removed because it becomes swollen and inflamed. If it's not removed in time, it can burst and cause infection in this entire abdominal cavity, and that's much more serious. So it's important for a person to be diagnosed early when they have appendicitis and remove it if it looks like it's something that's not going to go away on its own, which in most cases it doesn't. So then we have the first part of the intestine, which is called the ascending colon. So the large intestine, the first portion, stool moves upward, calling this the ascending colon. Again, there's the appendix coming off of the bottom portion of that large intestine. And then the large intestine crosses over the abdomen. This is called the transverse colon, where it crosses over. And then it descends downward again. This is called the descending colon. And then it makes this kind of flattened S turn here before it becomes the rectum, and this is the sigmoid colon, this portion here, the sigmoid colon. And then that stool descends down into this muscular canal called the rectum. So this is the rectum. And then this last portion where it narrows, this is the anal canal. And at the very end is the anal sphincter, which is under voluntary control, that a person can control when they are going to have a bowel movement. Now children, obviously young toddlers, don't have that control right away, but they do develop it around age 1.5 to 2. So we have the rectum, anal canal, anal sphincter at the very end. So that's the end of the digestive tract. When we look at these next few structures, these are called accessory digestive organs, which means they play a digestive role, but they have other functions in the body for homeostasis as well. For example, the pancreas, we know it secretes insulin, and it also secretes another hormone called glucagon, but that's for the endocrine system. That is secreted to the blood. It's not secreted to the digestive tract, so that's not a digestive function. What the digestive function of the pancreas is to secrete the digestive enzymes. So here's the pancreas. It has this cottage cheese-like appearance. It's found on the left side, left of the midline in the digestive or in the abdominal cavity, and it secretes those digestive enzymes to the duodenum. So this is the first part of the small intestine shown here, and that is the pancreas secreting enzymes to the duodenum. The liver is the largest organ in the body, and it secretes bile. Its job is to make and secrete bile, and it does that through these special ducts here. And then the gall bladder is this small green structure. It's tucked up under the liver on the right-hand side, and its job is to store some of the bile that is produced by the liver. But most of the bile that is secreted into the digestive tract, all of that comes from the liver. Just a small percentage of what the liver produces is stored by the gallbladder. So the contents of bile enter this duct called the common bile duct, because we can see some of those ducts come from the liver, one comes from the gallbladder. So where they come together here and lead to the duodenum, this is called the common bile duct, and that again leads to the duodenum. Some people that have gallstones, they might get a blockage in this duct, and that can cause pain and problems and eventually lead to needing the gallbladder removed. A risk factor for gallbladder problems and gallstone is being overweight, having a high-fat diet, and being over the age of 40, and being female. Those three together in combination increase the risk for gallbladder problems. So it's important to have a diet that's not high in cholesterol if a person has gallbladder concerns or starts to develop gallbladder problems. So that concludes our lab on the digestive system.